Hello everyone. According to Encyclopedia of Sociology, between 5 to 12% of men and 10 to 20% of women will experience this disease during some time in their life. Can anyone guess my topic? I am here to discuss depression. I will reveal the types of depression, the diagnosis, and the treatment. My research for this speech was found in Encyclopedia of Sociology, Major Depressive Disorder, and the Gale Encyclopedia of Mental Health. First, let's discuss the types of depression. Dysphoric mood is short-term depression due to loss of a loved one, lost a job, stress, feelings of separation, and many more. Dysthymia mood is long-term depression. Feel depression during the day on most days, keeps them from doing everyday activities. Major depressive or clinical depression happens a couple of times during one's lifetime. Many people who suffer from this have the same symptoms as a person who has depression. Bipolar or manic depressive illness is also part of the types of depression, and it's rapid changes in mood. They have racing thoughts and affects their way of thinking. Next, let's discuss the diagnosis. People must show at least 5 symptoms in order to be diagnosed with any type of depression. Symptoms include depressed mood, loss in interest and pleasure in all activities, feeling fatigue or insomnia, meaning they sleep too much or sleep very little, gaining or losing weight unintentionally, decreased or increased in appetite, unable to make a decision, feeling of guilt or worthlessness, and suicidal thoughts. Lastly, let's discuss the treatments. Psychotherapy is an alternative, promotes a positive environment to people and lifts their spirits, rewards them when they have done something, mainly because people with depression focus on the negative aspects in life. But there's a wide variety of psychotherapy that people can decide to take. It all depends on the person and the type of depression or mental illness that they have. Medications is a big one that a lot of people take when they have depression, and antidepressants work for some patients, and it may be hard for them to find one that works for each individual. So they would have to take multiple pills, multiple medication to finally find the one that is right for a certain person with the certain depression that they suffer from. There are a few side effects to the medications that may affect them physically as well as mentally, meaning it can make them even more depressed, having more suicidal thoughts, etc. Other approaches to a treatment for depression could be electroconvulsive therapy, which is a therapy in which the patient receives an electric shock in the brain. Though this was left a while ago, it is still an option. Though people may have seen that it does work, but I don't think it's very effective compared to other ones, but it's still an option. Today, we have discussed depression and covered the types of depression, diagnosis, and treatments. Depression affects more than 16 million people in the age range of 15 to 44. Thank you.